Alright, now we're going to be talking about the axial skeleton. So let's get going. This is the sternum. This is the manubrium. This is the body. That is the xiphoid process. That is the jugular notch. These are the two pairs of floating ribs. These are the ribs. We have 7 pairs of true ribs. One, 2, 3, 4, 5, 6, 7. We have 1, 2, 3 pairs. 1, 2, 3 of false ribs. This is a series of fused bones called the sacrum. Underneath that is another series of fused bones called the coccyx, which are our tailbones. These are the cranial bones. This is the frontal bone. These two are the parietal bones. This is the occipital bone. That is the external occipital protuberance. It is the site where ligaments and muscles hold the head upright. This is the coronal suture. It is formed when the frontal bone and the parietal bones join together. This is the sagittal suture. It is formed when the 2 parietal bones fuse in the middle. This is the lambdoid suture. It forms when the occipital bone joins with the posterior end of the parietal bone. This is the coronal suture. It forms when the frontal bone joins with the anterior portion of the 2 parietal bones. This is where the squamous suture should be. It is formed by the temporal bone fusing with the frontal bone and fusing with the parietal bone and the occipital bone. Okay, so here, this is the mandible. This is the coronoid process of the mandible. This right here is the mandibular notch. This is the mandibular condyle. This is the ramus. Right here is the angle of the mandible. And here is the body of the mandible. We have here maxilla, and here are the alveolar processes. These are the nasal bones. There are 5 lumbar vertebrae. This is lumbar vertebra 1. This is lumbar vertebra 2. This is lumbar vertebra 3. Lumbar vertebra 4. Lumbar vertebra 5. These are the cervical vertebra. There are 7 of them. Cervical vertebra number 1, cervical vertebra number 2, cervical vertebra number 3, cervical vertebra number 4, cervical vertebra number 5, cervical vertebra number 6, cervical vertebra number 7. These are the thoracic vertebra. There are 12 of them. Thoracic vertebra number 1, thoracic vertebra number 2, thoracic vertebra number 3, thoracic vertebra number 4, thoracic vertebra number 5, thoracic vertebra number 6, thoracic vertebra number 7, thoracic vertebra number 8, thoracic vertebra number 9, thoracic vertebra number 10, thoracic vertebra number 11, and thoracic vertebra number 12. This is the spinous process of the vertebra. These are the transverse processes of the vertebra. This is the body or centrum of the vertebra. This is the intervertebral disc. They are in between 2 vertebrae. These are intervertebral foramen. These are where spinal nerves come out. This is the external auditory meatus, or known as the external acoustic meatus. This is the sella turcica, where the pituitary gland sits. These are the zygomatic bones. Together with the zygomatic process from the temporal bone, they form the zygomatic arch. The transverse processes of the cervical vertebra have foramina, which make them unique. This is the vomer. It forms the nasal septum with the perpendicular plate of the ethmoid. Of the interior, no, the function of the inferior nasal concha is to warm the air that we breathe by allowing the air that we breathe to swirl around the scroll and come into contact with the mucus, which is warm. That also encourages air particles to get trapped in the mucus. These are the facial bones. Inside the nasal cavity, this top portion here is the perpendicular plate of the ethmoid bone. This is the mastoid process. That is the styloid process. This is the temporomandibular joint. This is the temporomandibular joint. This is the squamous portion of the temporal bone. These are the optic canals. Those are where optic nerves go through. This is where the sphenoid is inside the orbit. This is where the superior orbital fissure should be. It allows nerves that control eye movement to go through. This is one side of the sphenoid laterally on the skull. This is the other side of the lateral side of the sphenoid. This is the interior view of the skull, and here we have an interior view of the sphenoid's greater wing and the lesser wing is underneath. This is the cribriform plate. It is part of the ethmoid bone, and it has little holes for olfactory nerves to pass through. This right here is the crystal galley. It is part of the ethmoid bone. It is a projection that the outermost layer of the covering for the brain attaches to. These are the petrous parts of the temporal bone. They house the internal ears and the middle ears within the internal ear cavities and the middle ear cavities. The internal acoustic meatus allows cranial nerves 7 and 8 to pass through. The vertebral column has 4 curves. One curve is here in the cervical area, which is concave. Second curve here in the thoracic area, which is convex. Another curve here in the lumbar area, which is concave. Another one here in the sacral area, which is convex. The two convex curves, one here in the thoracic area, and the second one here in the sacral area, are known as kyphosis or primary curves. Secondary curves are here in the cervical area and the lumbar area, otherwise known as lordosis. This is the atlas. It articulates with the occipital processes of the occipital bone. The atlas allows me to nod, like so. This is the rib. Rib attaches to two vertebrae by the head. Here's the neck. On the bottom, that is the tubercle. The rib connects to two vertebrae by two facets. The first facet is the superior costal facet, and the second one is the inferior costal facet. Okay, so that's it about the axial skeleton. So until next time.